Yeah.
Okay, so before we do get started, I always kind of do this disclaimer that this presentation is not intended for any formal diagnostic or treatment for any of the things that we're going to discuss today, but it definitely is a resource. And if you have any symptoms related to the content of this presentation or any other condition, please make sure you first and foremost consult any medical professionals in charge of your care. So today, or like Jen said, my name is Marissa Capaco, and I'm a speech language pathologist for the Centers for Rehab Services. And I currently work in the Cranberry area, the North Hills, primarily out of the Lemieux Sports Complex. Today, we're going to focus a little bit more on attention, which in hindsight, I probably should have flipped the last topic and this topic, but both of them are going to be really important. Last month, we talked about memory. This month will be attention. And the reason I say maybe I should have kind of switched them is attention really, as you can see on the screen, we call it the foundation. So it's the foundation for a lot of different things that we do in day-to-day life and has a great impact on our thinking. So what is attention? Attention is a very important cognitive ability. It really drives a lot of what we do in day-to-day life, from driving to preparing meals, handling tools, performing tasks at work, studying, and just engaging in conversations. And if attention is impaired, it can lead to some difficulties like increased risk of injury, maybe some social faux pas, if you're not paying attention, feeling overwhelmed, or not quite understanding certain concepts. And this, like I said, affects other cognitive areas. So in order to help with attention, attention skills help us really to focus on what we have at hand. But not only that, also help us to learn and understand information, whether that's information that we're reading, information that we're hearing and seeing, really about any subject, anything that we need to do in day-to-day life. It enables us to concentrate on something in an extremely noisy environment, maybe like an open floor plan office setting, or if you have a bunch of kids running around the house. Attentional skills are things that help us to kind of concentrate in those areas where we might have more noise and more distractions. It also helps us to divide our attention between several activities. And this, we're constantly talking about different ways that we're dividing our attention. And this happens all throughout the day, as simple as driving while having a conversation with a passenger, maybe trying to have a conversation on the telephone while somebody's talking in the background. Really, attention drives a lot of our daily activities. But when it does require us to divide our attention between certain things, we do have to use more of our brain resources. Aging is also a process, also a part of this process. And aging with attention is correlated with a decrease in attentional resources. So we have a harder time with higher sensitivity and a harder time, which then leads to interference and thus communication breakdowns or cognitive breakdowns. Along with aging, any type of trauma to the brain, whether that's treatment from cancer or really, any other diagnosis that might have some type of interference, traumatic brain injuries, concussions, stroke, any type of damage or effect on the brain really makes us more sensitive to interference with attention, just like aging does. It can affect, or it can help us with new concepts, learning new concepts. So paying attention to what experts or teachers tell us affects our concentration while attending and reading a book. And without attention, we can never memorize or master new material, including something like paying attention to this presentation today. Mm-hmm. So attention is not only strongly dependent on what's happening in our environment, which we call those things external factors, but also it can be affected by what's happening inside of you. It can be affected by your mood, motivation, priorities, interests, pain, fatigue, anything. Those environmental distractions certainly can have an impact, but like I said, how we're feeling can greatly impact how we're managing attentional tasks as well. But this also is gives us the capacity to easily engage, release, and then re-engage in something. It's needed for us to process information, to skip from one source to another, and learning to control our attention is a good asset. So there are 4 major types of attention related to cognition, and we'll briefly go over each one of these today. The first is sustained attention. Then we have alternating attention, dividing our attention, and selective attention. So for sustained attention, it's really simple to catch somebody's attention in a moment, but it's a lot harder to get somebody to sustain their attention. So again, maybe I was able to get you engaged from the beginning, but sustained attention might kind of waver throughout the rest of this presentation, for any other considerable amount of time. So like I said, this presentation is an example, listening to a teacher or a lecture for a whole hour, reading books, and noting, reading books and notes in order to review, answering test or exercise questions, completing any extensive tasks that we might have throughout our day, even if something as simple as watching a TV show and engaging in that show could all be affected by sustaining our attention, or can all be impacted by lack of ability to sustain attention. Then we have selective attention, which is when we're faced with several different environmental factors or stimuli, or those internal factors that I briefly discussed. The human brain naturally responds to selecting particular aspects or factors to focus on. And that's what selective attention means. So it's our ability to select from many factors or stimuli to focus only on one thing at a time, or whether that's your brain selecting it, or maybe you intentionally selecting it because of importance. This is the type of attention that we're using most of the time. And really, we're always being exposed to different types of environmental factors at home, at school, in the office, but our brain can really only focus on one of those factors. And even as we're sitting here today, maybe if somebody walks into the room, you have to really select to pay attention to what we're talking about versus getting distracted by anything else going on in the environment. Then we have alternating attention. So this is our ability to switch or immediately transfer our focus or our concentration from one activity to another. So the brain instantly adapts, even if the activity we were doing has a different level of knowledge or comprehension. So like selective attention, alternating attention is also our ability, or is also something that we're doing a lot of the time. This might be talking on the phone. Let's say you're cooking a recipe for dinner and you're focusing on that task. If somebody walks into the room and starts to have a conversation, you have to select to switch your attention from preparing the recipe to talking to that individual, and then also have to alternate and go back to paying attention to what you were doing in the first place. So this is an example of us alternating our attention. Divided attention is the ability for an individual to focus on or concentrate on 2 or more stimuli at one time. And we might call this multitasking. This is where, you might call this multitasking. it is considered a desirable talent for those who are gifted with this ability, but really that means it's very difficult to divide our attention. It's very difficult to multitask. And it's hard for people to acquire this skill, especially after some type of trauma to the brain. And I will say this over and over again in a lot of presentations across a lot of topics, but our brains aren't really meant to multitask. Even if 10 years ago it was easier, we still aren't giving 100% effort to 3 or 4 things at one time. Maybe we could manage that, but it still wasn't 100% effort. So our brains really aren't meant to do this type of attention. And in my experience, I think this is where people end up kind of having some of these attentional breakdowns when they try to do too much at one time. So there are a lot of different interventions that can address attention. Just skip ahead one second. One of them is being cognitive therapy, which myself as a speech language pathologist, we would be individuals who would address any type of attentional components or concerns, other things like memory, problem solving, and things like that. But in addition to seeking actual assistance from a professional, there are some computer-based training programs. Many of the tasks used for these attentional programs are computerized. And typically they were things that have to be purchased, but I even sometimes will encourage my own patients to incorporate things like video games, because, I mean, to a healthy degree, video games actually have a certain degree of attention, memory, problem solving, decision making, processing, and doing these kind of computer or electronic based activities can help with attentional skills. And there are also training tasks that could be created to simulate different types of cognitive tasks for attention. Attentional training tasks should address a specific type of attention, and some types of attention will be described in the areas following in the next slides. So kind of going back to this divided attention, if we remember, this is our ability to respond to more than one thing at one time. So tasks for this might include something as simple as maybe sorting mail, while also monitoring time, maybe paying attention to a timer on the stove, or cook something in the microwave to determine when a certain interval has lapsed. So you can kind of work on those skills by doing 2 of those things at one time. And I will say, I don't necessarily recommend doing that. You know, I know even myself, I've definitely put something on the stove to boil water and got too distracted and didn't come back to it. So I don't necessarily recommend doing that, but that would be kind of an example of something relating to this attention. So then we have strategy. So, you know, we're identifying that we're having these attentional skills or impairments, but what do we do? What do we do about this? So we have training, but we also have some strategies. And that's what kind of the focus of the rest, a lot of the rest of the presentation will be. And I really encourage you to kind of think about some of these strategies, because the way that we're kind of changing the format of the lectures is within the Cognitive Toolbox is to focus on strategy. So 1 month, we'll do more of an informative presentation like today. Over the course of the month, I'm encouraging individuals who are participating to kind of track what strategies they're using throughout the month and how effective they are to improving different areas. So are these strategies helping you with attention? Are these strategies helping you with memory? And this really helps with making these things more functional and more meaningful. So the first part of this kind of goes back to this divided attention example, reduce distractions. So you can improve your attention span. Improving your attention span requires you to improve your mental clarity and focus. And so in order to do that, you will probably need to remove any needless distractions. Kind of leading into that, the next one, focusing on single tasks. The brain has a hard time handling multiple tasks at once, but it rather switches very rapidly between. This increases our stress on the brain and our strain on the brain, which then can result in fatigue and maybe cause us to do more sloppy work, make more errors. Monotasking, or just doing one task at a time, is really the only way to use your attention span to the best of its ability. Maintain a planner and a work calendar. So avoid forcing your mind to kind of strain to remember things or other priorities, and use a planner, use a calendar, use those kind of things, which help really to kind of free your mind to focus on a task that's at hand. Limiting social media usage and discussions can be helpful. And sometimes even myself, I have to kind of give myself technology breaks where I close down my computer chat at work, I close my email, I put my phone away so I can really just kind of focus on what task is in front of me. So limiting social media usage can be helpful. And if you do need to engage in those things, and it's okay to do those things, maybe give yourself a time limit, how often you're going to be on those types of resources, or when you're going to turn them off. Minimize any social media windows. You can put your phone on silent mode or vibrate mode, and really use these uninterrupted blocks of time to be more creative and productive, as opposed to kind of being swept up in whatever's happening with our technology. So for most people, it's a case of implementing functional strategies and sticking kind of to a few guidelines. So the first guideline is to be self-aware, and this still fits within our strategies. I a lot of times will bring up the term metacognitive awareness, which just simply means thinking about your thinking. So being self-aware kind of ties into that. So learn to be aware of your current level of attention, concentration, and fatigue. And that can really help you to kind of further guide when is a good time to do certain tasks. When do you need to take a break? When do you need to use a certain strategy? So just kind of knowing situationally what times you're doing the best, what situations you do the best, and the times that aren't as great, and using strategies accordingly. And one way you can do this is to create a scale of 1 to 10, with 1 being total relaxation periods and 10 being periods of a lot of stress and exhaustion. So when you're about to attempt a task, look at your scale. If you score yourself between a 1 and a 4, you can probably go ahead and incorporate whatever task you were planning to do. It's a pretty safe zone as far as maybe getting ready to achieve certain things and accomplish certain goals. However, if you look at that score and it's between a 5 and a 10, maybe that's a good time to take a break, or attempt anything at a later time. I a lot of times use the example of think of things like marathons. Marathon runners don't go out and just run 26 miles. There's a lot of training involved. They take breaks. They do whatever things they need to do to kind of help give them energy along the way. And your brain is the same thing. So let it have breaks. That really can help you in the long run reduce fatigue, pay attention a little bit better, reduce errors. As far as strategies for internal distractions, we kind of mentioned earlier, this can be things like pain, mood changes, really anything like that, fatigue, stress, depression. If you feel anxious about completing a task, write down what worries you. And you'll often find that your fears are kind of unfounded. It's sometimes the anticipation of doing tasks that really takes your attention away from what you need to do. And with that, you can write down rational responses to irrational fears. And not to discount, I mean, some of these things could be very rational, but sometimes when we actually take a look at the things that are causing us concern within a task, you might actually find that you can manage it. Building your confidence is important. So aim for progress rather than perfection. I tell a lot of my patients, I do not expect things to be better overnight. We're looking for progress over a period of time, whether that's days, weeks, and months. And to kind of help with that, make a plan that's specific and break it into small steps. So give yourself breaks after each step. If you have a large project that you need to work on, or just sometimes overwhelming things like going through medical bills or going through your mail, make a goal. I'm going to go through 3 envelopes today and then take a break. Okay, I'm going to go through 3 the next day, then take your break. Doing things like that helps to build your confidence and really set you up for success in the future. Plan and write down a task, and that can make it seem a little bit easier. Write down the steps if you need to, including any time that you feel like you need to take a break. And when you do accomplish it, reward yourself. If things don't go as planned, know that you can stop and reattempt the task at another time. Prioritize the tasks that need to be completed, and just kind of with breaks, breaking those small tasks down large tasks into smaller parts. Complete 2 or 3 small tasks each day. So make a list and just do 2 or 3 things each day. But with that, you also have to be flexible. So understanding that we are going to have errors. We're not all 100% all the time, regardless of the situation. And that kind of brings me to a point that I don't believe is on here. But sometimes I tell patients to, when it comes to this planning part, plan higher priority tasks, higher demand tasks at the times of day that you feel like you're the most alert, whether that's in the morning, after lunch, at the end of your day. That's going to look a little bit different for all of us. But if you have the ability, try to plan certain tasks for times of day when you feel you're on your A game. Monitor your fatigue. This is really important. And many times people with chemo brain can suffer higher levels of fatigue than normal. And it's really important to be aware of that fatigue because it could have a major impact on our attention. Well, okay, so I guess my last strategy was on here. So this means scheduling activities that require your attention at times of day that you feel your best. But that doesn't necessarily just mean fatigue. It can be anything. Look at your environment and see what kind of modifications you can make, like reducing any noisy distractions, like a TV, radio, other people talking. I know myself, depending on what the situation or what kind of project or documentation I'm doing at work, I might have to sit in my office. I can't work in an area where there's a lot of like a group setting. I don't really focus that well, and I know that. So depending on what I'm doing, if it's higher priority, I know I have to stay in my office to do that task. And it doesn't even have to be noisy. It can be visual. So if your environment is cluttered and messy, try and tidy things up a little. Maybe if you have a large window that's distracting, maybe you hang some curtains or some blinds and just open it at certain times of day, so that you're not getting too distracted by the things that are going on outside. So in order to do that, we have to decide what are our distractions, kind of be aware of them, and how can we change them. So I gave you some examples of considering your environment, but if you cannot change your environment, then try to move to a new environment. Or sometimes changing the environment can simply be sitting down to work versus standing to work, or to do anything. I know sometimes I feel like even now, with a lot more people working remote, you're seeing more and more individuals who are using like standing desks. So even if you can't change your environment, try to switch something up in your environment, like standing versus sitting, or just facing a different direction, anything like that. Again, brain breaks are important, as well as overall health. So looking after all aspects of general health will help you perform better on a daily basis. So maintaining adequate nutrition, sleep, exercise, and relaxation. Well balanced and healthy diets, staying hydrated are very important. Sleep is a huge one. And you know, that looks a little bit different for everybody. Sometimes people function very well on 6 hours of sleep. I am not that person. Sometimes people need 10 hours of sleep. So whatever works best for you, going back to that self-monitoring, try to make sure you have sufficient enough sleep. Try and do some exercise every day, but also relaxation techniques. You know, this is something that's sometimes overlooked, but can really help with a positive and healthy lifestyle. I talk a lot in my sessions, especially at the beginning, about self-care. And I know sometimes it's hard when you're actively going through treatments, or, you know, concerned about pending treatments, or trying to, you know, kind of work through remission. And but it's really important just to take care of yourself, and to take, you know, even if that's 5 minutes, 10 minutes every day, just to do something for you. It could be sitting in a room in total darkness, or, you know, going out for a walk, or meditating, or yoga, whatever is relaxing and calming for you. It's really important to incorporate. So, and this is getting a little repetitive as far as the multitasking, but, you know, limit that multitasking. Don't multitask. If you have to divide your attention between two tasks, try to do one task that relies on more of our mental concentration, and one that's a little bit more physical, like listening to the radio is mental, while cleaning the sink is more physical. So yes, you're doing two things at one time, but your brain and your body are kind of managing those two tasks a little bit differently. I think sometimes one thing that's a little bit underrated is how much concentration really is required to listen to and follow conversations. It really takes a lot of mental energy sometimes, especially if we're tired. So try to self-monitor so that you're aware when attention is beginning to kind of falter. Repeat important parts back in your head, pick out key pieces of information, disregard the non-important stuff. Focus on who, what, when, where, why. You know, sometimes I think naturally we give a little excess information, so only focusing on the main parts can kind of help your brain to process the information a little bit easier. But it's okay to ask for clarification. So request more information, probe, ask questions to gain further information, paraphrase, kind of repeating information in summary back to the listener, and summarize things in your own way. So pull together those key points of a conversation, just to kind of help you to retain what you need to and what you need to pull from that topic. So quick overview. Learn to be self-aware and monitor your attention. Monitor your fatigue, schedule breaks, allow time to complete tasks, make plans and break your tasks into small steps, adapt your environment to eliminate distractions, evaluate and monitor distractions before you start a task, be flexible, stop, replan, or reschedule if you need to, develop a system of alarms and reminders to help keep you focused, manage internal distractions, like if you're anxious, write down your fears, try and attempt to do one task at a time, allow yourself breaks, and congratulate and reward yourself when you have completed something. Always consider the importance of health, nutrition, sleep, and exercise, as well as relaxation, and use some of those self-monitoring techniques that are important in conversations. Try to use active listening skills during conversations. And if you need to, I always call this self-advocacy, but you can also make others aware, or if you feel comfortable, let others know of things that you might have trouble with. Hey, I might ask you to repeat certain things. I have a little bit of a trouble with memory sometimes. It's okay to do that. And it actually sometimes takes a little bit of a pressure off of you that might also bog yourself down as one of those internal distractions. It's really important to have everybody together, your house, maybe family, friends, just to kind of help you adapt your environment and really facilitate more success when more people are involved in aiding in some of these strategies. So thank you for your time and for your attention. This is my phone number at my office, as well as my email address. If you have any questions, I'd be happy to help. But here, once we end this presentation, we will go ahead and address any other questions. Thank you.